Hello, everyone. It is 12:59. We're going to give everyone another minute or two before we formally get started. But welcome to the NKDO Engage webinar on post-donation depression. We're all very excited to welcome you all to this webinar on this super important topic. We're going to give everyone just a couple more minutes before we get started. But we're happy you're here. All right, it is 1 o'clock on the nose. We're going to get started. Good afternoon. Thank you so much for joining us. My name is Emily Polet-Monterosso. I'm the Executive Director for the National Kidney Donation Organization. This is our fourth Engage session in the 2025-26 series, where we aim to engage, educate, and empower attendees on a broad range of living kidney donation topics. Through this series, we hope to raise awareness, build community involvement, and increase the number of living donations to help end the kidney crisis. We are grateful for the privilege of hosting these educational sessions, thanks to a renewal for the second year of a generous grant from Sanofi, which is a global leader in immunology. Today, we focus on the topic that doesn't get a lot of attention, which is the experience of people who experience depression after donating a kidney. There is obviously a lot of effort put toward educating people who have started the process of donating a kidney, but there is not a standardized process at different transplant centers to giving that education, and not all prospective donors get the same education on this topic. So we wanted to make sure that we were giving people an opportunity to learn more about this phenomenon from people who have lived experience on the topic and from an industry professional. So we decided to dedicate this webinar in this year's series to this super important topic. Today, we will hear from an industry expert and living kidney donor who manages a team of mental health professionals at Healthy Minds Consulting, LLC. Healthy Minds Consulting, LLC offers counseling services to adults, teens, children, and couples, and provides each client with appropriate screening and assessments to determine diagnoses. Treatment plans and research-based interventions are then developed and utilized to help clients reach their goals, and clients are provided with any additional services they may need within their community that may help them receive comprehensive care. Some of the conditions that they specialize in include anxiety, depression, trauma, PTSD, family conflict, grief and loss, and much more. Our special guest, Leilani Mason, is a licensed independent clinical social worker, a certified EMDR therapist, who is also credentialed in crisis intervention. We're very lucky to have her here today to speak to us about post-donation depression. So thank you so much for being here, Leilani. We will also hear from a panel of 3 people who are kidney donors who personally have experience with depression after they donated their kidneys: Christine Haan, Lana Prechtl, and Amy Devin. Thank you all so much for being here. We're really happy that you're here. A couple of housekeeping notes. The people who are here for the webinar, you will notice that this is a webinar style event, so your microphones and cameras are not available, but you can use the Zoom Q&A box to ask questions. So please do that during the event. We will be taking those questions after the event, after the presentation and the panel questions, the panel Q&A rather, so that you'll have an opportunity to speak to these individuals and ask them your questions as well later in the presentation. A little bit of information about NKDO. NKDO was founded in 2016 by non-directed donor Ned Brooks. It is the largest member-based donor advocacy organization in the country. Our mission is to support living kidney donors and those who wish to learn more about the living donation process through mentoring, education, community building, and advocacy initiatives. We hope this webinar will help to educate people considering living donation and empower them with hope, inspiration, and useful tools. For those of you who are on the call who are considering living kidney donation, who have not donated a kidney yet, or who are just gathering more information about living kidney donation, we hope that you'll have an opportunity to better understand the unique challenges of people who are in this situation, and also come away with tools for how to navigate this experience after this session. Please understand that not all living kidney donors experience depression after donation. Conservative estimates currently range from 3 to 8% of donors reporting having this experience in the 5 years following their donation. However, this is something that hasn't been closely studied, and the sample sizes have been small. So many of us in the living donation community feel that it may be underreported and deserves a closer look, and certainly more conversations like this one. Okay, so to start us off, I'd like to introduce our guests. Our industry expert is Leilani. She's the owner of Healthy Minds Consulting. She donated her kidney through the National Kidney Registry at the University of Kentucky in July of 2024. A stranger received her kidney through the voucher program, and her mother received a stranger's kidney in August of 2024. She's prepared to share information with us about why people might experience depression after donating a kidney and what the best thing is to do for someone who is experiencing those feelings. Christine Haan donated her kidney in September of 2023 at Barnes Jewish Hospital in Missouri. Her left kidney went to a firefighter there in St. Louis. Christine, we're glad you could be here. Lana Prechtl is a living kidney donor who donated her kidney in 2023 to her cousin at the University of Utah. Lana, thank you for being with us today. And Amy Devin donated her kidney to a coworker who has since become a dear friend. Both Amy and her recipient live in Montana, a state with no transplant centers. So their transplant took place in Seattle, Washington at UW-Medicine. So now I would like to hand the floor over to Leilani. And then once she's done, I have a few prepared questions as well, and then we'll take questions from the Q&A afterward. So Leilani, over to you.
Thank you so much. And I would love to thank the NKDO because that is where I received all my information. When I decided to go on this path, I was Googling and that's what I found. And that's really the support that I got. And so I really appreciate everything that you do. So talking today about the hidden side of giving, the side that we don't talk about enough, the side that maybe we hide, we mask a little bit, and that's understanding donor depression. Oh, I just saw the note come up, so I was making sure that was for me. So when we talk about kidney donation, we use words like selfless, generous, life-saving. I think we've heard those words. But today we're focusing on what happens after the surgery, when life returns to normal, but something internally doesn't feel, it feels a little different. So many donors expect to feel only gratitude, fulfillment, but for some, there's also sadness and fatigue or emotional confusion. And if that is you, we want you to know that you're not alone and that there's nothing wrong with you. So we're going to talk about statistics first. I know that Emily gave us statistics also. We know that they're all, there's a very small sample. There's not a lot of follow-up from donors that you would expect. I think it's going to grow as we grow and we learn more things. But right now, the population that has reported is low. So most donors do not develop long-term depression. Studies overall show the rates of depression in living kidney donors is similar or lower than the general population. So a major study published in the American Journal of Transplantation found about 4 to 8% of donors report depressive symptoms long-term, which is pretty comparable to the population norms, so the rest of society. Short-term emotional distress is much more common in donors. So in the first few weeks to months after donating, studies show up to 25% of donors report some depressive symptoms, usually mild to moderate. And those symptoms can include fatigue, emotional letdown after surgery, and anxiety about their recipient's outcome. And most of these symptoms resolve within 3 to 12 months, and probably because within 3 to 12 months we start to feel better, the recipient may be doing better, and so some of those anxiety symptoms reduce, and then in general reducing the depression. But a small group experience significant depression. 5 to 10% of donors experience persistent depression, anxiety, or a difficulty adjusting back to their new life. And that risk actually increases if the recipient has complications, or even worse, passes away. If the donor feels pressure to donate, that can increase this risk, and if there's prior mental health history. So if they come into donation already with a history of depression or anxiety, we know that this is a traumatic experience. And I don't mean traumatic necessarily that it has to be negative, but it is a trauma to our body. And you can't separate the mind and body. So when your body is going through these changes, it's going to change the chemical balance in our brain as well. And another thing that increases the risk is limited social support. Being a kidney donor requires an army of social support. You have to have a good support network to be able to get through this in a healthy way. And recipient outcome really matters. It really affects how the donor perceives the whole experience. And one of the strongest predictors of donor depression is if the transplant fails or the recipient dies. Donors are significantly higher risk of depression, grief, and even guilt-related distress to the whole event. So it's often described in research as complicated emotional response. So it's not just a standard depression. It's complicated. It has many facets to it. Donors often report positive mental health outcomes as well. So many donors report increased sense of meaning or purpose, improved self-esteem, stronger relationships. And this is why the emotional outcome can often be described as mixed or complex, not simply positive or negative. Any feedback there from just that part of the presentation? I see some of you nodding your heads, so maybe some of you have experienced some of those as well. Okay, I'll go on to the next. So why depression can happen. So there are multiple factors that contribute to this emotional change after donation. So first, there's the emotional high leading up to the surgery. So in my lived experience, it was just focusing on, am I going to be able to do this or not? You know, it's like, am I going to pass the test, right? Am I physically going to pass the test to be able to give this to this person that I care about or I love or that I want to have? And so you're every day you're waiting for the next test result. My experience was they say I had $1 million workup. So, you know, you're tested from every bit of your physical sense, and you're just really hoping that you're going to be the one, like choose me, choose me. And so there's that emotional kind of roller coaster that goes with that in itself. There's a lot of what ifs, there's a lot of I hopes, and then there's also sometimes a little bit of maybe it won't be me. I don't think everybody likes to admit that, but there was times that I was like, oh, well, that'll get me off the hook if it's not. And then there was the other part of me that was like, but I really want to be able to do this for my person. So there's this emotional high leading up to the surgery. You're just trying to make it to it. You're worried about dates getting canceled, rescheduled, getting sick. I mean, there's so many variables that happen. And then after the surgery, it's followed by a natural drop. So it's just an emotional drop that happens after. Second, the body undergoes significant physical stress. So we can't separate the mind and body. This is going to impact our mood. This is going to impact our energy. When we're not feeling good physically, we're going to struggle to feel well mentally. And then there's this identity shift. So being a donor brings a lot of meaning, a lot of attention. When you're in the process of becoming a donor, my experience with the university was just constant contact, a lot of positive regard, a lot of care for me, a lot of how are you doing? I mean, they went really above and beyond while I was in the hospital. I always say, like, I've never been treated so much like a queen. And it's not that you're not important after, it's just that the follow-up looks different. And so there's this loss afterward of attention. And so going into this, you would hear like, oh, that's amazing that you're doing this thing. And even if you didn't want to hear it, it always made me a little uncomfortable to hear all of these things that people would say to me, you're this, you're that. And I'd be like, I'm just trying to keep my mom alive. But after that falls off. And so there's a shift that happens emotionally and with the things you're experiencing externally. So relationships may shift in unexpected ways, even when the outcomes are positive. Recovering can mean you're not able to do the things you normally do to cope with stress and anxiety. So this was one of the strongest indicators for me is I was very physically active. In order to be able to donate a kidney, usually you have to have pretty good physical health, which means that you probably do things that keep you to be physically healthy. And so I wasn't able to do those things anymore. So the gym was off the table for a while. I didn't feel well enough to go do the things that bring me joy and excitement because mine are outside and they're physical. And so that can also contribute to depression. If you're not able to do the things that you normally do to create those chemicals in your brain, the serotonin that helps with depression and anxiety. And then you may not have the support of family or friends. My lived experience, I had teenagers and my son, who was 16 at the time, was not supportive of me having the surgery. He blatantly had told me he did not want me to, and I did it anyways. And so in recovery, I had an expectation of how he would treat me through it, and he was very frustrated with me, and we had to work through that. So you may or may not have that support of family or friends. Some people may not want you to do this surgery, your spouse may not want you to, your children may not want you to. And so you have to navigate that because they're going to do things and react in a way to try to protect themselves as well. And that can be really challenging. And then anxiety, we talk about the depression, but what often can lead to depression is anxiety. So when you're stressed and anxious about the whole process, which is very stressful, and you're every day worrying that phone call from the nurse is going to be a no, this isn't going to happen, or this has been rescheduled, or there was tons of scenarios that we were waiting on. That anxiety continuing in that way can actually lead to depression because our body cannot stay in hypervigilance and hyperarousal for very long periods of time because your heart rate's up, your blood pressure's up. And so your body's going to drop and you're going to go into what's called the dorsal vagal nervous system, which is going to be depression. So anxiety also about your own health. During the process itself, I don't know how much I really considered my own health in it. I mean, it was there, but after the donation, when you're not feeling your best and you start to go, oh, this feeling I have in my body, does this mean something's wrong with me? And you start to pay attention to the numbers and how your kidney is processing, and that can lead to a lot of anxiety over your own health after donation or even before. So symptoms donors may experience. When we talk about depression, it's important to understand it doesn't always look the same for everyone. It looks different in the outside world and in the donor life. It's not just sadness. I think a lot of times we think of depression as sadness. And for many people, it doesn't look like sadness. It can be really subtle at first. Depression often shows up across different areas of our person's experiences. So it can show up emotionally. It can look like sadness, and we're like, where does this come from? I don't have a reason to be sad. My recipient is doing well. I'm doing well. Why do I feel this way? It can be numbness. It can show up as irritability and agitation, and that can be really confusing. The people that are trying to take care of us, and we're irritated and agitated, or a loss of interest in things we usually enjoy. Sometimes that can be because we can't do those things anymore, or sometimes it can be that we have a loss of interest in it. So if we know, like, normally I enjoy doing these things, or I look forward to this thing, and now we're just kind of like, that's a clue that we might be experiencing depression. Cognitively, people may notice increased self-doubt, guilt, guilt and shame that don't belong to the situation, overthinking, or even questioning their decision or overall experience. And I think that can really be tied into the anxiety of, like, what did I do? I know when I first woke up and experienced the physical pain I experienced, my first thought was, oh God, what did I do? And fortunately it settled, but that can be some of our first thoughts. And it's hard to express that, in a room with people saying, thank you so much. You're such a hero. And you're like, I kind of think, I don't know what I just did. Like, this might not have been my best decision. And, so there's some guilt and shame in that. Like, should I be thinking that way? Or guilt and shame in, like, there's a part of me that's kind of nervous to do this. Or there's a part of me that kind of regrets doing this. And then the guilt and shame of, but what about that other person that needed this? And so you're conflicted. Your internal parts can really be conflicted in this, which can leave us confused. Physically, it can look like fatigue, low energy, changes in sleep, either not sleeping well or sleeping much more than usual, which is really difficult to decipher because those are also the symptoms of recovery, and part of the symptom of learning to live with one kidney. So for a while there, my experience, and I know we'll hear from everyone, but was the fatigue, and that was really difficult to overcome for me, and still working on. And then medication, that's going to alter our mood. And so when you are taking pain meds, and you're navigating that can have some real effects on our mood. And then relationally, it might show up as withdrawal, feeling unappreciated, or even unexpected frustration towards others, sometimes towards the very people that you felt closest to, maybe even to your recipient. So one of the challenges, especially for living donors, is that these symptoms can overlap with normal physical recovery. So feeling tired, kind of off, or emotionally different after surgery can be expected. Which can make it harder to recognize when something more is going on, to determine, is this also my mental health? So some additional signs to pay attention to include difficulty concentrating, feeling mentally foggy, changes in appetite, or a general sense that you're just not yourself. I felt all of these things. So I think that they can be normal, and I think it's just depending how long they are lasting. So of course, if there are any thoughts of hopelessness or not wanting to be here, any suicidal thoughts or self-harm thoughts, then that's something that deserves immediate attention and support. So that would not be a normal response to the donation. So if these symptoms are lasting more than a couple of weeks or impacting your daily functioning, or you just don't feel like it's worth, you just don't feel like you anymore, then it's definitely worth reaching out and assessing. Getting support early can make a significant difference. And that's for a lot of reasons, because experiencing depression and anxiety post-donation can really affect your relationships, right? It can affect your future with the people that you care about and love. And also, when our brain chemistry starts to change in the way that we're not producing what we need, the serotonin, the dopamine, the feel-good hormones, then it's really difficult to get it back doing what it's supposed to do. There's actually things we can do to make our brain reproduce these things. And so the earlier that we catch it, the more that we can start to change that brain chemistry and get ourselves back on track. So I just want to take a moment to normalize something that doesn't get talked about enough, and that's that emotional and mental shift that can happen after donation. So even when everything goes well medically, and mine did. I did great. My mom did great. It's very common for donors to notice that they don't feel exactly the way they expected to afterwards. I don't really know what I expected to feel. Maybe relief, I'm not sure. But it didn't feel exactly the way that I thought it would. And there can be a sense of emotional letdown once the surgery is over. And you prepared for this big moment. There's a lot of focus, a lot of fuss, a lot of purpose, and then suddenly things quiet down. And for some people, that can be surprisingly difficult. Others may notice shifts like feeling more emotional than usual, more irritable, or even a little disconnected. And some people describe it as, I thought I would feel one way, but I actually feel something completely different. And it's all normal. This is a normal within the range of normal. So this is significant physical and emotional experience, and your body's recovering. Your nervous system has been through stress. And I know in general, we don't talk enough about our nervous system. People don't know about or how to navigate it. That's something that you learn a lot in therapy. but your body is recovering, your nervous system has been completely distressed, and your mind is adjusting to everything that just happened. And we have to have grace. It's also important to remember two things can be true at the same time. You can feel proud of your decision and still struggle emotionally. And that is definitely something that I had to work through. Proud of my decision, and that it's okay to be proud of my decision. It didn't mean I was being prideful. And also, hey, I'm struggling at the same time. And those experiences are not in conflict with one another. We can hold space for both. So normalizing this matters because people don't expect it. They can start to question themselves, wondering what's wrong with me, when reality, nothing is wrong. You're just may simply be experiencing a part of this adjustment process. And when we understand that ahead of time, it becomes much easier to recognize when we just need support versus when something more significant is going on. Any feedback at this point? Any agreements upon experiences?
Yes to everything you said.
Yes, lots.
Okay.
Yeah, the one bit of feedback I would have is that I would not say that my experience was that I experienced depression per se, but I will say that right after my donation, I almost immediately found a social media group of living kidney donors, which it hadn't even occurred to me to look for other living donors prior to my donation. And when I stumbled upon that group, it was revelatory to me to get connected with other living donors. It hadn't occurred to me to find other people who had done this thing. And I remember feeling really excited to connect with other people who had done it. And it felt like a group of people who were meeting a need I didn't even know I had. And I think that I probably would have struggled more if I hadn't gotten connected with those people at that time. Because the support system I had, while they were great, they hadn't gone through what I had gone through, and they couldn't speak to the experiences that I was having the same way that people had who had gone through the same experience that I had had could speak to that experience. And so I think I just lucked out that I stumbled upon that group when I did. And so I think that an underutilized resource is connecting living donors with each other, either before or shortly after they donate.
Even now, hearing these symptoms and getting a little bit of recognition, it kind of hits me in the heart again. It's good to be connected with people who have done the same thing that you have done, and yeah, this is great. I wish I would have had this going into it.
Yeah, I agree. I think that they talk about it like, when you're doing your pre-workups and everything else, there is a social worker that talks to you and asks you how, but I don't think there's the follow-up afterwards. And I don't think that there's like that connection to be able to have somebody else that's gone through it to kind of talk you through it, because these people are talking to you, but a lot of them have not done what you've done. And so, everything that was just said, I was like, yep, I felt every single one of those things at some point of the process after donating, for sure.
I agree. I immediately went to a Facebook page and added myself to it and got kind of nervous at first because there were some experiences on there. And I do tend to find that people tend to stay more connected on the Facebook pages when they have not had a positive experience. And so sometimes I was going through it like, oh my gosh. But I do think that it gave me a good reality of what I was actually doing and kind of took the kind of unveiled, am I willing to do this even if this happens or this happens? And so I was able to sit in other people's experiences and kind of go through that with my mind of like, how am I going to handle this if this happens? How will I feel if this happens? And so almost doing my own therapy at that point of kind of navigating those feelings. So yes, and then also I saw a comment, I'm trying not to look at them at the same time, but someone made a comment about, feeling bullied. The wording was bullied by people who've had positive experiences. So those that did not have positive experiences. And, I do think that statistics are low of people having a negative experience or reporting it. And so then you do tend to experience, even on the social media, like a lot of people talking, oh, my experience was great. I didn't have that. I didn't have that. And I didn't have that. And that can almost make you feel like you're not on another island alone, part of a group, but didn't have the same experience as the rest of the group. So just making sure we have space for everyone, and that it isn't always magical or positive for everyone, and that's okay. That doesn't mean that we can't be grateful for our experience and still support other people.
Yeah,
So
the community's experiences are definitely varied.
Varied, definitely. And something I was thinking about last night when I was talking to my husband about this is that there are people, and I don't know about you ladies, but that have never had surgery before. And so their donation, and that kind of makes sense, right? They've never had anything unhealthy, so they've not ever had a surgery before. Their donation is their very first surgery ever in their life. And I just thought about how scary that would be. I had multiple surgeries before I did this surgery. So I'm like, I'm good. I know what's going to happen. I had a different expectation or understanding of what that might look like in before, during, and after surgery, where I know that a lot of people have never had surgery. My sister had never had surgery. And if she had been the one that did this, it would have been her very first surgery ever. So that's, her expectations of what that might look like would have been different than mine. So the family and lifestyle dynamics. So this is where I see as a clinician and clients coming in as donors that we work through. So some donors are part of long-standing family systems where health issues are connected to patterns such as substance use or neglect of health. Okay, so meaning their recipient and it has had a history of maybe some self-harming choices in their life that led them to needing this kidney, and neglect of their health. And these patterns may have been present during the donor's childhood. Okay, so the donation can reactivate old emotional wounds or roles such as feeling responsible for others. So this is not about blame, but about understanding the emotional complexity of this. Donors can feel love and resentment at the same time, and both experiences are valid. So sometimes our recipient is in need of a kidney because of some of their life choices. And those life choices may or may not go away or be replaced just because they received this life-saving kidney. And being able to navigate, how are you going to feel about that? And that can very much contribute to our mental health. Any feedback there? Okay. That is definitely something for donors to navigate, is how are you going to feel if this person goes back to the unhealthy choices? And what are your expectations of this person going to be? Are you going to expect that they're never going to eat this or drink that? Are you expecting that they're all of a sudden going to start going to the gym and have this whole new appreciation of life and now come over and visit you and now babysit your kids, or now you're going to go on vacation? Like, you can really dream up this idea of, I'm doing this so that they can do all these things, so that they can be the person I wanted them to be, or have the life I wanted them to live. And one thing I've really had to navigate is that receiving a kidney doesn't fix every medical issue that they may have. And so being able to have a realistic and appropriate expectation of what could happen for your recipient. My mom had a lot of medical complications that the kidney did not completely fix. So we still are navigating those things. And if I had, and I did have this grandiose idea of like, we're going to be traveling now, we're going to be doing this, and we're going to be doing that, and we're going to be doing this. And that isn't the case. Is her life improved? Absolutely. Can that be enough? Can I provide this and then say, I'm not in control of what this person does with this. I do think that there's pros and cons of the direct or non-direct. And because I did the non-direct, I didn't feel territorial over the kidney that I donated to my mom. I don't know how that would have affected our relationship. So making sure that you're navigating your realistic expectations, and understanding that people don't change all of their behaviors, or your relationship will not be healed with that person because you donate a kidney to them. And I think that that's a fallacy that often people tell themselves. And you see a lot on social media in these groups about how actually relationships are then severed after donation. And I can only imagine the depression, the guilt, the shame, the disappointment that would bring to a donor when the relationship doesn't improve. In fact, it goes the opposite direction. And yeah, and someone said that, my husband was a donor and he worries about that aspect daily. And it is true. And I think that they did ask me some questions about it. And so I was thankful for that. And I had a lot of conversation about it. And I've had to talk with my sister about it. Like, we can't dictate that person's every move of their life. You can't be knocking cookies out of their hand. So they still have to live a life, and you need to be able to navigate what that's going to feel like for you. It will not fix anyone. It will not fix your relationship. It will actually bring on some stressors to your relationship, and you need to be ready to navigate that in a healthy way. I see a lot of that with spouses, because they're with that person all day long, every day. I'm not following my mom around creepily. She's doing her life, but spouses tend to. So before donation, so let's talk about the mental health screening. So prior to donation, programs conduct a psychological evaluation to assess readiness. And I remember being really nervous. And it was this poor young little master's level social worker. She's working at the hospital. She's trying to ask me these questions. And I'm like making sure I'm getting around everything because I know what to say because I'm a therapist, right? And really, she was just screening to see what my support network was. But I often wonder how many people sort of don't answer the question honestly regarding their mental health because they're afraid of being denied. And I think that just does a disservice to yourself, and that this is the time to be open and honest. And I have worked with clients that the program at wherever they were donating was like, we're not saying no, we're just saying pause and let's take a look at your mental health and make sure that you are healthy and ready, because it's just as important to be mentally healthy as it is to be physically healthy for this donation. So they do this assessment for readiness, and it includes discussing motivation, like what's your motivation to do this, understanding risks, mental health history, support systems, and expectations. And just because you have a mental health history of depression or anxiety, or maybe you're medicated for depression or anxiety, does not immediately rule you out. But they can assess for what are the needs you're going to have and be really honest about what this could look like. So the goal is to ensure informed consent and reduce risk. However, screening happens before donation, and emotional responses can still emerge afterward. The nurse would ask me, how are you doing physically? I heard it as physically. And I think that we need to improve in the how are you doing mentally after also. And then there's a bit of a sense of shame sometimes, I think, of I'm not really doing okay, but I don't really want to tell anybody, because everybody else is celebrating, and I'm struggling. So that can really make you feel isolated. So it doesn't mean that the screening failed. It means emotional processing can continue over and over. So just because you went into it mentally healthy doesn't mean that you're not going to have some struggles after. So when we talk about the support that's available after, so of course there's professional therapy, which provides a safe space to process those emotions and experiences, the things you probably don't want to talk about with your other family members or friends. Again, that hiddenness of these are my concerns, this is what I'm worried about happening, these are some of the negative feelings that I'm having, and that's even before I had conflict. I held space for, I want to do this thing because I want my mom to live, But I also had a part of me that was like, I'm a little nervous. I'm scared. I don't know if I want to do this. What if something bad happens to me? I'm a mom. How am I going to do this financially? There's a lot of stressors. I own my own business. I didn't get paid while I was out, you know? Um, and so just having someone that you can talk to about that neutrally, that it's not going to get back. Because if you tell your brother, your sister, your friend, your husband, your nephew, you know, I'm having some concerns about having some reservations about this, um, then you may feel like they're going to shift to telling everyone this, and it could change the direction of this. All right, so I'm going to get to my closing message. I got that message from Emily. So donating a kidney is one of the most selfless acts a person can make. But even the most selfless acts does not make someone immune to emotional struggle. So if you're struggling, you're not alone. Seeking support does not take away from what you gave. It actually honors it. And we talk about support for living donors. It's important to understand that it's not just medical. There's several layers of support available, and each one matters. There's mental health support, which can look like individual therapy. There's donor-specific support, like the National Kidney Foundation and the National Registry and the Donor Shield. There's informal support systems like family, faith, communities, or even online groups. It's not just about having support, it's about having people you can be really real with, that you can be raw and honest with, not just people who see you as heroic. You know, that was always difficult. I didn't want to just talk to the people that saw me as heroic, but people who can sit with you even when you're struggling. And then there's the practical support, which is often underestimated. Things like financial stress, time off work, managing those daily responsibilities, raising kids during recovery, that can really take an emotional toll. And sometimes what feels like depression is actually just being overwhelmed. So having help with meals, childcare, the day-to-day stuff can make a very significant difference. And at the end of the day, support is not a sign that something is wrong. It's part of taking care of yourself through a really significant life experience. And the more intentionally you build that support, the better your overall outcome is going to be. All right, so I'm going to turn it back over to you, Emily.
Thank you so much for that. I really, really appreciate it. Would love to just turn it over to the panelists. I'd love for each of you just to chime in. We're going to start with Leilani. Can you tell us a little bit more about when you realized you were not feeling quite right after your donation? And I'd love to hear from each of you on that. So just like a quick summary of what that was like for you. You're muted.
I knew the moment I opened my eyes something was wrong. I had expected the incisional pain and the gas pain because I had had prior surgeries, but it was in my ribs. And I said, something's not right. And it was overlooked. And at one point, I opened my eyes and I asked the nurse, is it time for my pain meds? I'm suffering here. She rolls her eyes and walked away. So then the next thing I remember is it turned out to be my patient liaison come in and spoke to me. And at this point, I am still, coming out of anesthesia. And all I remember at the time is a beautiful pink suit and a shiny face. That's all I remember. Admittedly, my mistake. But she walks out of the room, and my brother, who had flown in, now I had my donation in Utah and I reside in California. And she walks out of my room, and my brother said, "Hey, Deeds, what'd you do to make her mad?" Now, he said not such nice words, but what did you do to upset her? And I said, I don't even know who she is. So I did at that point. I'm like, I made it my mission to do everything the hospital staff asked me to do so that I could get home. And the next thing I remember that day was I was struggling keeping things down. So they kept giving me an oral medication for vomiting. And my team is standing there and I'm getting sick, and I say, can you give it to me intravenously because the oral is not working? And so they did. And then I, went home, and 4 days after surgery, I call my team. Now I'm back in California at this time. I call my team and say, hey, I'm really struggling with pain. I need some help. Can you give me direction? What do I do? And my patient liaison said, you just couldn't handle the surgery. Go to your urgent care. So I do. I mean, this is 3 days of phone calls back and forth of me trying to get a hold of my team and get help for the pain that I was in. And my husband looked at the pain medication that they sent me home with, and he said, honey, it's over the counter meds. We need to get you some help. So surgery was on a Thursday. The following Thursday, tired of waiting on my team, I land in the ER, and the team at the ER were so upset at University of Utah for putting me in that position that they instantly helped me move forward. So to move forward, the 2-week follow-up was with Dr. Zimmerman, the head of the surgery team. And I told him I still can't breathe. I cannot move. Everything's what I expected incisionally, gas-wise, but these ribs, I just cannot breathe. I'm told at the 2-week that if I'm still hurting at 4-week follow-up, they'll do some testing. Awesome. I'm thinking 2 weeks, in 2 weeks I will have help. So the 4-week follow-up comes along, and the gal that I am speaking to was more impressed with her work on closing my incision than getting me the help for the pain that I was dealing with. Once again, I was dismissed and told, just go to your primary care physician. You probably got a rib injury from the positioning, and this is what she did. From the positioning we put you in during the surgery, you probably just got a rib injury. Go to your primary care physician. So I have spent thousands of dollars out of pocket to figure out and prove what University of Utah did to me. Like 7-8 months later, it finally come back after CTs, many appointments, ER visits, that I am been left with costochondritis. And if anybody's ever had a rib injury, they can understand. This is something I will live with for the rest of my life. And every time I've reached out to my team, my patient liaison told me, you just couldn't handle surgery. And I kindly had to remind them that prior to surgery, I trained in martial arts, Kachikimbo and Eskrima, specializing 5 days a week, and I walked at least 4 miles a day. And now I can't breathe, can't move. And they never took responsibility. About 1.5 years after surgery, it took me getting a patient advocate there at the university. And this is me after reaching out to people saying, what do I do? What do I do? What do I do? Everybody told me, patient advocate, get an advocate. So I did at the University of Utah. I spoke to her one time. That was November of 2024. Surgery was September 2023. And I got one visit with the surgery team, with a surgeon, not my surgeon, a surgeon from the University of Utah via Zoom. And I explained what was going on, the testing I had done, and they completely denied everything. And the phone call ended with me thanking them for their medical gaslighting, and that this is extremely inappropriate. And I was promised that the office manager would call me to discuss my medical bills to get them covered, because I also ended up with a pretty nasty blood clot in my hand that landed me in the ER because my primary care physician sent me there because we thought I had a DVT. All of that was denied. Your problem. And is kind of the attitude I got. So after that phone call in December 2024. I let a month go by figuring, okay, it was agreed upon that they would get me help locally in Fresno to help me figure out what was wrong. So I gave it a month figuring, medical things take time. Maybe they're just trying to get all of their phone calls made and whatever. So I reached out to the patient advocate another time to say, you know what, I can't reach anybody. Nobody's returning my calls. And so when I reached out to the patient advocate, 2 weeks apart from each other, I'm told the same thing during both phone calls. We know who she is, but we can only give her a message from you. So I have heard nothing from University of Utah, and I am at least $3,000 into trying to figure out what they have done. And I took it upon myself to go to a chiropractor to say, hey, what is wrong with me physically? And she said the positioning of the surgery pushed my ribs up behind my shoulder blade. And that's what I had been living with for 1.5 years. And thankfully she was able to help me. And I've been able to move forward since. So as far as receiving care and anything, there was none.
I'm so glad you were able to get a solution, even if it was after that long, and I can see how that would cause depression.
Yeah.
Christine, I would love to hear from you a little bit more about when you realized things weren't quite right for you after your donation.
Very similar to Delana. It was right after. I felt like something was a little off. And it was, just like Leilani said, during what she said about, you just kind of have this weird feeling like you're happy you did it. Like, I will never say that I'm not happy I did it. I think it was, something great. I'm very happy that my recipient is doing well. And, I didn't know him before, but now I do. And he's like family. But I could tell right afterwards. And I think, as women, especially, we have this, thing about our bodies, we have to look a certain way. And I think as soon as I woke up and I was able to get out of bed, I noticed that like my stomach didn't, look the same. And it wasn't because of the gas or anything like that. There was something that just didn't look right. And that's something that's what, brought on my depression was from right from the beginning, is just that my stomach doesn't look the way that it did beforehand. And I've had 5 other stomach surgeries. So it wasn't something like that. It was just something that happened during the surgery or, because I had a lot of scar tissue. So it took me a good year to kind of come to terms with that, what, this is just part of the process. And, you did a good thing and this is what you're going to deal with forever. And, I just have to be okay with it. And, none of my family or friends cared what my stomach looked like, but I did. So I think that was the biggest part for me. And I do think, and I answered one of the questions, I think that, and I don't know how to make this happen. So maybe as part of the National Kidney Donation organization, but I feel like if there would be a way to, have volunteers reach out to new people that have donated maybe in their state or in their city, and be like that person to be able to listen and just hear what they're saying and validate the feelings that you're having. I think that's really important because I was part of those Facebook groups. I didn't feel like I could talk to people about what I was feeling because you almost feel like, okay, you were a hero and you donated and all those things. And you don't want to talk about the bad part of it because you don't want to push anybody away from donating because it's so important. So you don't want to provide any negative feedback because you want more people to do this because in all, like, I'm perfectly fine. My life has went on the way that it should have. I can still do all the same things and I actually can do more things than what I did before because I pushed my body to do those things. So I think that's part of it, is just feeling open to be able to talk to people about what you're going through and not feeling like you need to hide it because you don't want anybody else to say, okay, well, because of what Christine went through, I'm not doing that.
Absolutely. And we do have a volunteer mentor program where NKDO members who have gone through the living donation process are available to speak with any prospective donor who wants to get plugged in with them. And I've put the link in the chat. So if any prospective donors want to get plugged in with a living donor, you can go to that link and fill out a form, and an NKDO living donor will be reaching out to you to get connected and answer any questions that you have. Um, Amy, we would love to hear from you in the last couple of minutes that we have. And then I have one more question that I'd love to hear from everybody on the panel before we wrap things up. But Amy, if you could just let us know just what was the first time that you noticed things weren't quite right after your donation?
Yeah. So I went into this knowing that I have major depression and anxiety and ADHD, and knowing how to deal with those things. I mean, I've been living with that diagnosis for quite a while. So I felt like, okay, I'm ready. I've got a support group in place, medically and friend wise, and I can get through this. And then when I got done, like was spending my 2 weeks on site, since we did this out of state, I could kind of feel the same thing that you guys were talking about like I should feel like I did something amazing, and I wasn't feeling that way at all. And it took me a while to kind of come to terms with that. I didn't have, I thought, okay, well, maybe tomorrow I'll feel this. Once I'm healed up a little bit better, maybe tomorrow, maybe the next day. And my recipient was feeling all sorts of amazing, happy feelings and doing very well, physical wise. But I was struggling with both the mental and the physical. One point that really stands out to me, it wasn't the first time I recognized it, but at 6 months, I went out with my recipient's family and my husband too, and we went to a basketball game. And I remember just sitting there feeling like I know this is something I should be interested in, and I know I'm with people that I love and should be happy with, but I'm just feeling nothing. Like I'm the shell sitting here. And I think that's I liked how Leilani pointed out that depression isn't necessarily just crying all the time and feeling sad. There's a big component of it, at least for me, that is kind of a not feeling, like going through all the motions, and you got to get to the other side of it, but it's kind of a slog in the process.
Thank you so much for that. One last question I would just love to hear all of you guys reflect on. If you could give one piece of advice to a prospective donor about how to manage their mental and emotional well-being post-donation, what would that be?
I would say, utilize the resources that are available and don't hide behind what you did. I think that was my biggest downfall is I just tried to act like everything was fine and it wasn't. And so, like I said, trying not to push people off and make them feel like it was a negative experience, because it wasn't a negative experience. I just had, unfortunately, a negative reaction to it. And so I think just putting it out there, I know my family in that case is not, they don't talk about depression. It's not something you talk about. And obviously some families are more open to that than other families. And my family just wasn't one of those families that was open to it. So I couldn't talk to my people. So I think finding the person or people that you can talk to and be open with about your feelings is really important, and knowing that before you go into it, so you have a backup plan, so you're not trying to figure it out 3, 4, 6 months, a year later.
I would kind of echo your thoughts there, Christine. Have your system in place, whether it's medically with a psychiatrist and a counselor, and or your support system friend-wise who can help out with those things. That was essential for me. And also, I'm going to be selfish and do too. Also know that a lot of times the the anesthesia can bring on a depression like quick and hard. I knew of that going in for me, um, and my depression went on past that. But just know that, sometimes it's the meds, it's trauma on your body, just like Leilani was saying. There's a lot to it, and it's okay.
Yeah, I definitely second that. That anesthesia gets me every time. Um, I would say preparing for the journey just as intentionally, the emotional journey of this, just as intentionally as you prepare for the physical and the medical one. I remember going on Amazon and being like, I'm gonna have this support pillow and I'm gonna have these pajamas, and I did a lot of preparing for this physically, drink my water, all these things. And I think I probably did more emotional preparing just because of what I do as in my profession, but there was definitely more emotional preparing that I needed to do. And again, having that person to talk to, I found a therapist. I went to a therapist from the beginning of the process all the way through. Every therapist has their own great therapist. And so I could talk about some of the things that I knew could possibly potentially be a problem between my relationship with my mom. I think that a lot of people, again, donate to someone whom they love. I mean, it's wonderful. If you don't know the person too, that's great. It doesn't change anything, but there is a lot of complications to the experience when you then have to navigate a relationship through it. And so I had that person that I could talk to about all those things without feeling like a terrible, awful person. And so I would suggest that you have that, whether that's a therapist. Not everybody has to have a therapist. Just find that person that you can talk to that doesn't immediately say to you, "Oh, you shouldn't do it then," if you're having these negative thoughts, or someone that you feel safe saying that to, because they don't think of you as a hero, and just that safe space. And that would be my biggest advice, is that you prepare for it emotionally just as much as you prepared for it physically.
Final super quick thought, Delana?
Am I unmuted? I think that one, sitting in my position all this time later, be the thorn. I wasn't the thorn. Be the thorn. And just know that others' actions have zero to say about who you are as a human being.
Awesome. Well, thank you guys so much for your participation on the panel. Leilani, thank you so much for your expertise, and thank you everybody for being in attendance and for being patient as we're a couple minutes over time. But I think this was a really fruitful conversation. Apologies for not getting to the Q&A. The conversation was so fruitful that we didn't get to a lot of those questions, but hopefully we got to a lot of the meat of the part of those questions in just the conversation itself. So just really grateful for all of you guys for being here today, and hope you guys enjoyed the conversation and have a wonderful rest of your Tuesday. We'll see you guys next time. And don't forget to fill out the survey. It is going to be on the screen as you guys log out, and it will be emailed to all of you guys as well. Thank you so much for being here. Have a great rest of your day.
Thank you. You too.
Thank you.